Hi, everyone. It's 4 o'clock on a Monday, that time we come together. And remember that we're going to get through this. We're going to get through this together. We're going to get through what appears to be nationwide, the second or the third wave of this virus, certainly our third escalation. It's concerning. And later I'll talk about how today is the highest number of positive cases we've ever had on a Monday. So we continue to see rising cases, but that just means we've got to come together to do what it takes to defeat this virus. As for me and my family, we are now over a weekend of living our quarantine dream, answering the call, trying to set an example about when you were asked to quarantine to stop any potential continuation of this virus, that we do what we're asked. That's our duty as Kentuckians. And that's our duty as Americans. My family is feeling healthy. We tested negative for the second time at the end of last week, and we'll be tested again this week. We're feeling good. We're feeling good physically. We're also feeling good spiritually and emotionally. And a lot of that is based on a lot of really nice cards and messages and support from people out there. That includes from Boyd County Public Schools, who we're representing today. They are back in person, at least to some degree. We appreciate them doing what it takes to keep their students and teachers and all of their faculty safe. We appreciate what they do. We're going to go over our Fast Four today. Those are 4 things going on in state government we want to make sure you know about. Then we're going to have the Lieutenant Governor go over some things especially related to our schools. And then we'll hear from Dr. Stack. So our Fast Four at 4 starts with stopping scams. So Thanksgiving and Christmas are very quickly approaching. Halloween first, but then Thanksgiving and Christmas. And I want to bring awareness that there are still so many out there that would try to take advantage of us during those holiday seasons, even in the midst of a pandemic. As Attorney General, it was one of my core missions to fight scammers and protect Kentucky families, especially our seniors and veterans that are targeted at such high rates. As governor, I'm continuing to carry out that mission. We've created a charitable giving guide to help Kentuckians ensure their hard-earned dollars are used to help their neighbors and not stolen by scam artists. The top things to consider are plan your giving in advance and don't respond to mass charity solicitations or suspicious charity requests. Second, research charities and verify their 501c3 status. Third, identify a charity aligned with your values. Fourth, donate an amount or level that you're comfortable with and don't give in to pressures about upselling, giving more. 5, donate safely by using a credit card or check. 6, watch out for imposters and ensure the organization you're donating to is a legitimate charity. Review the guide online at governor.ky.gov or on my social media accounts. I encourage you to share it with your friends and family, especially our seniors in Kentucky who are targeted by these scammers day in and day out. We are our brothers and sisters' keeper, and we have a duty to protect one another. Whether that is doing the right thing in the middle of a pandemic to save lives or helping protect one another from scammers during the Christmas giving season. Let's continue to do the right thing to help our teammates on Team Kentucky. Second part, this is good news. Jobs. Topi American Inc. has been located in Frankfort since 1985. It supplies steel wheels for the North American passenger car and light truck markets. Its customers include Fiat Chrysler, Ford, GM, Honda of America in Canada, Kia Motors in Georgia, Hyundai Motor Company in Alabama, Nissan North America, and Subaru. Subsidiary of Topi Industries Limited in Japan, it was the first Japanese auto supplier to locate in our Commonwealth. The company has just now completed a $38 million renovation of the Frankfort facility, and that includes a new wheel assembly line and workplace improvements such as lighting and climate control. The project is crucial for the company to retain the current staff and to build its marketing presence. It was originally announced in December of 2017. Company's commitment to its current staff with the hopes of future growth comes at an important time as the automotive industry battles through the difficulties caused by COVID-19. Kentucky is currently home to 200 Japanese-owned manufacturing, service, and tech facilities. Japan is Kentucky's #1 international investor, employing approximately 47,000 people full-time. The project builds on Kentucky's impressive automotive sector, which includes 520 suppliers. In total, the auto industry employs over 100,000 Kentuckians. Good things are going on in this Commonwealth. Companies that are going to be poised for amazing growth, millions of dollars of investment we're making in infrastructure so that we are ready for the future, so that much brighter days are ahead. But we still have to get through the present. And that's why number 3 on our fast forward today is relief. And here, utility relief. So I know this is a difficult time for Kentucky families, and this administration continues to take aggressive action to try to help those that need help in this downturn. We created the Team Kentucky Fund to help our struggling families in so many different ways. We are providing rental assistance to those that need it. We signed more people up for Medicaid and for SNAP programs for food assistance during this time. We provided dollars to child care centers to help them get through this crisis, and we continue to try to help everyone who qualifies under the federal government standards for unemployment. Now, we're creating additional protections and programs for those concerned with their utilities being cut off. I signed an executive order in May to suspend disconnection of utilities for non-payment. The Public Service Commission for utilities it regulates began a moratorium on cutting off utilities for non-payment in March as well. However, the PSC issued an order that on September 21st, that ends its moratorium beginning October 20th. To ensure that there are protections when this begins, I signed an order today that ends the moratorium on disconnections on November 6th, but takes additional steps to help protect Kentuckians. The orders require that utilities enter into payment plans with residential customers for a minimum of 6 months beginning November the 6th. It encourages utilities to do the same with non-residential customers. The order also continues to waive legal fees for residential customers through December. The order will make the requirement consistent across Kentucky utilities. Here's the thing. The order also dedicates $15 million in federal coronavirus relief funds to create a Healthy at Home Utility Relief Fund. The relief fund will have broad eligibility for Kentuckians who have past due payments and will focus primarily on water and wastewater services that are critical to fighting this pandemic, but it'll include up to $2 million for other utility services. Community Action Kentucky and community action agencies across Kentucky will be taking applications for the fund and administering it. We will soon share more details about the fund and applying for relief under it. Customers will apply through Community Action, but the funds will go directly to the utility to pay off those past due bills. Community Action administers the LIHEAP program and is accustomed to assisting folks that need this type of help. While it's a difficult time for many Kentuckians, this is another resource for our families. Some other resources include Team Kentucky Fund that can be used for utilities as well, the COVID-19 response funds in Louisville and Lexington, the United Way of Kentucky, LIHEAP, the Salvation Army, and our religious communities who are all providing help in this area. It's just another way that we're coming together to meet our basic needs. So today we signed an order that will create another fund, here a $15 million fund to help Kentuckians that right now can't pay their utility bill because of COVID-19, to not only get those paid, but again, to make sure we're not emerging from this pandemic with so much debt that we can't crawl out of it. All right. Last, we have our Mask Up KY campaign. You know, we talk a lot about what people aren't doing. We worry a lot about the small group of Kentuckians and Americans that aren't following public health advice. We probably need to spend a lot more time thanking people for doing the right thing, giving them that positivity that we need to continue doing the right thing throughout the length of this pandemic. Maybe to spend a little less time talking about folks that won't put on a mask and a lot more time encouraging people that do to keep it up. So today we've got a couple of really great examples. The first one is from Christina Sanders, who's talking about Miss Courtney McReynolds preschoolers at Rockfield Elementary. They are doing a great job of wearing their masks while they are doing their schoolwork. Listen, this is something that our kids can do and will do. And when you tell them that it's about protecting and helping other people, they want to do it. So we appreciate them doing the right thing and encouraging others to do it as well. All right, the second one is from Brandon French. With Halloween coming up, showing us a little bit of fun with pumpkin carving. Remember, there's Halloween guidance on how to trick or treat safely in your neighborhood and in your community. Please follow it. As a reminder, the CDC doesn't think you should be trick-or-treating. We know that people are going to do it, so we've developed a way to do it safely. But it can't be people holding a bowl while other people reach in. Please spread it out on a table or up and down the driveway, individually packed. Please sanitize your hands before laying it out, and each time before laying it out. And parents, wipe down the candy when it comes home. Stay in groups of your own household. It's really important that we don't have big packs of kids running around. It's a way that we can get this done this year and also do it safely. So thanks to Brandon for giving us a little bit of encouragement. This last one, I really love. This is our Floyd County Schools. This is an incredible individual, Keith Mosley, who says he wears a mask to do his part to keep those that sit behind me safe. On my bus, they become my kids, and they are all special to me. I'm going to do what I can to protect them. You know, in a scary and difficult time where we're trying to bring our kids some normalcy with them going back to school where they can, where the virus will allow, this is the type of special example and special person that'll keep us safe. All right. So moving into today's COVID report, we continue to see cases escalate. I'm going to ask that they put up what I call our stair stepper chart, which shows what weeks have looked like here in Kentucky with our weekly totals. James, that's the purple chart. Kenneth, that's the purple chart. Al, that's last week's purple chart. If you have this week's, if you could take a look for it, I will come back to it. Today's report has the most cases that we have seen on a Monday throughout this pandemic. And here, they've got the chart up now. Look, where we are is, and I'm looking down at it, in the midst of our third escalation, which we've talked about. That very first one that was so concerning was back in March and in April. Remember, we didn't have enough PPE. Hospitals were overrun in New York and New Jersey. We didn't have tests to even know how many people had it at that time. And even our food supply chain seemed like it might break down at any time. That was a very difficult moment where we all across this country took very significant steps, but one we had to. One the White House urged us to do. One that basically every state did, because at that time, mass gatherings were spreading this virus at a time when we didn't even have good treatment for it, and the mortality rate was oh so high. But we came together as Kentuckians, and we truly came together. We did healthy at home for the length of time we need to, and we were able to plateau that curve. And then came the period of May, June, really up to about July 4th, where we had opened things up a little bit more. Maybe we got a little more lax, and we saw that next big escalation. That's when states like Florida and Texas and Arizona saw devastating results. A lot of the same type of loss, not quite as large as we saw in New York. And in both of those times, Kentucky was again able to come together the second time, mainly due to a mask mandate, but also temporary additional restrictions on restaurants and bars. Now we are in a third escalation. My concern about this one is it's not just regional. It is all over the country, and it's moving into the fall and into the winter. So without the backlog of cases that we saw last week, this would have been our single largest week, which means basically the line is going up and is going up fairly significantly. That means at a time when we need cases to be going down, when more people are going to be going inside, when our kids are going back or will be back in schools in some places, we need to do better. If we want to keep doing some of the activities that we're doing now, we need to keep doing better. This chart can't continue to go up, because when numbers of cases go up like this, so do hospitalizations, so do people in the ICU, and so do deaths. We never want to be in a spot like we have seen New York, New Jersey, Louisiana, Florida, Texas, Arizona, where our morgues run out of space and we have to have those freezer trucks come up. We never want to be in that spot. So we got to be vigilant. We got to stay strong. We got to keep our mental and emotional health, up in a positive direction. We got to do what it takes. Because today we're reporting 647 new positive cases of COVID-19. Again, this is the largest Monday we've ever had. Mondays are always lower than other days because of not all labs being open or reporting on the weekends. This is a very high number for a Monday. It includes 81 kids 18 years or younger. It brings our total cases since the beginning in the Commonwealth to 88,247. Positivity rate now at 4.97%. We have been under 5 for a long time, but even that is moving in the wrong direction. 764 Kentuckians currently in the hospital for COVID-19, 190 on an ICU, 190 fighting for their lives because of COVID, 89 on a ventilator. Today we also have 9 new Kentuckians that we've lost. Again, a very high number for a Monday. We've now lost 1,326 Kentuckians. And let me tell you, we don't put somebody on this list until they've gone through a full audit of a committee of public health officials. We do more work to ensure that COVID-19 was a contributing factor than just about any other state, and we follow the guidelines that have been given to us by the federal government. These are Kentuckians that I believe, but for COVID, would still be with us. And let's not lessen the loss to our families by arguing whether or not they should be on this list. This is devastating to each and every one of these families. And it hurts to read it out each day, but it hopefully reminds us that this is real. I mean, the first person on this list today is a 58-year-old man from Lincoln County. I don't know who that individual is, but I'm sure is likely to have parents that are still around that just lost a son. It's likely to have kids that just lost a dad. This virus it's real and it is cruel. And we ought to remember that to make sure we do what it takes to not lose individuals whose families are going to struggle. Second is an 82-year-old man from Franklin County, a 73-year-old man from Jefferson County, 73-year-old man from Marshall County, 83-year-old woman from Mercer County, 85-year-old man from Owen County, 70-year-old woman and a 93-year-old man from Todd County, and a 72-year-old man from Wayne County. Today, we're also being reminded that these individuals aren't just an age and a county. They are really wonderful people. So today, we're recognizing Ruthie Martinez, a beloved wife, mother, grandmother, and one of our teachers who passed away from COVID-19. Ruthie was only 49 years old. She lived and taught in Lexington and was called a warrior by Principal Hale of Winburn Middle School. We spoke to Ruthie's husband of 28 years, Miguel, who shared his wife was the most loving person and she always managed to find the good in people. He laughed, remembering she once said, "I don't know why, but the kids who sometimes act up always love me." And he said it because of her warm and supportive smile. And I think we see right there. Miguel said his wife was a terrific teacher and an amazing human being. She'll be missed by him, their children, and her grandchildren, as well as the students she impacted and all of those who loved her so much. Miguel, today I'm going to wear my mask in honor of Ruthie and ask every other Kentuckian to do the same. The loss of Ruthie is a tragic loss, I know, to your family, Miguel, and to your community, and to Winburn, to Lexington, and to all of us. We're so sorry that this has happened, and we promise for every other family out there, we will do better. We will work harder. We will stay strong, and we will try to make sure that other families do not lose their Ruthie Martinez. A couple other areas that we update in long-term care. We have 40 new residents that have tested positive, 24 new staff. As we go back and look at reports that of those that we've lost, 30 new additional individuals that we've previously reported fall into being in long-term care. And I'm sad to report today that we have 3 new veterans in our veteran home in Wilmore that have tested positive, and 1 additional death. Again, we are taking all steps there, and the loss of that individual is one we very sharply feel. Kentucky Child Care Facilities, we have at least 14 new facilities that have had at least 1 positive new test associated with them, 13 new staff members, and 12 new children that have tested positive. K through 12 public schools, 23 new students testing positive, 7 new faculty or staff, 28 additional schools have had at least 1 positive related to them, and 1 death. Colleges and universities, 31 new students, 0 new faculty and staff. Positive here, as it seems like the growth there is starting to slow down. We will hope that that will hold. With that, and recognizing the educator that we lost and that we were able to memorialize today, I want to kick it over to another educator that we are blessed to have as our Lieutenant Governor, who I know also feels this loss profoundly, Jacqueline Coleman.
Thank you, Governor Beshear. And you're right, to the family of Ruthie and Miguel Martinez, you are certainly in my thoughts and prayers. As someone who is from the education community myself, this is never easy. When you lose someone in your school, it's like a family. And so you guys are on our hearts tonight, certainly. I am here today to give an update on the school dashboard. Last week, I gave the very first update about the dashboard that is host to all of the numbers for all of our K-12 schools across Kentucky. And so I want to update you on that today. This dashboard exists because we wanted to create an opportunity for all of our school districts, our local health departments, and healthcare providers and families to work together so that we can support the ultimate goal of returning our students to safe in-person classes as soon as possible. This also gives all of our families and our communities a snapshot of where their school is in the fight against coronavirus. I always say that schools are microcosms of their communities, and so you can almost bet that if there is a spike in the community, you're also going to see one in the school system and vice versa. So this dashboard was made public on September 28th. And there are 1,732 K-12 schools in the database. And you're looking at a live version of what this would look like if you logged on to the website to see where your school or district is. So far, 1,570 schools have reported data for at least 1 day since September 28th. So I'm pleased to say that that means that there are 41 new schools that have reported since my update last week. But that also means that we are still holding at 162 schools in this state that have never reported in the 3 weeks that we've made this information public. So I want to say thank you to all of our education leaders across the state for doing the right thing. Our Kentucky families need that kind of effort and commitment from every education leader on a normal day, but certainly during the middle of a global health pandemic. So if you are watching at home and you want to check your child's school's reporting, you can visit this dashboard at kycovid19.ky.gov. If we're going to get through this, as the governor says every day, then we all have to be kind and accountable to each other. And it's in that spirit that I continue to be impressed with our schools, with our teachers, with their dedication, and certainly with our students' resilience. I want to give a shout out to a few school districts who have had to make really tough calls in the last few days. Anytime that you change course, it's not easy, especially when you know that your decision affects so many families within your community. So these are the school districts that have made the decision to either return to at-home learning or to move to a hybrid learning model. Adair, Clark, Floyd, Fulton Independent, Jessamine, LaRue, Lawrence, Martin, and Russell counties. These schools and districts are extending at-home learning, or they are also transitioning to a hybrid learning model. Barron, Jefferson, Perry, and Whitley counties. And let me just say that every one of us looks forward to the day when our kids can return to school safely, where they can be with their teachers, be with their friends, their coaches, their club sponsors. And I am certain that the decisions that our school leaders have made are tough. I know that they don't take them lightly. And I know that it's hard when your decision is popular with some and not popular with others. I've sat beside the governor since March as he's had to make tough call after tough call. And so I feel for you, and I know that it's hard, but I applaud you for using the data that we have to make an informed decision aimed at protecting your students, their families, your school staff, your teachers, and all of their families. So thank you. So stay safe and healthy to all of you on Team Kentucky, and I will send it back over to Governor Beshear. Thank you.
Jacqueline, we appreciate all your leadership. This is truly a Beshear Coleman or a Coleman Beshear administration. Couldn't have a better partner in governing, and we have needed everything that the Lieutenant Governor brings to the table, which is so much every day during this crisis. Now we want to hear from Dr. Stack, who has a couple of updates, including a brief explanation on an initial draft vaccine plan that we provided to the federal government that goes through logistics on when a safe vaccine is ready, how we will distribute it, much of the timing of which will be determined by how fast they can manufacture it. Steve?
Thank you, Governor. I think I'm off mute and everyone can hear me this time. Hopefully I got it right this for a change. It's nice to be here. I'm going to give you a quick situation update. James, if you could put up my slides. What we will do is I will start with an update for where we are, and then I'm going to go into the vaccine update. As far as the situation update on this slide, you have New York, which is orange. In the bottom line, if you look to the right side, you have Arizona, which is green, just above that. Then Kentucky, which is blue. And then North Dakota, which is the current hurting the most state as far as number of cases. Again, the reason I use this slide, it's adjusted by population. It shows the number of new cases. They've changed this. It's now per 100,000 people. which is the standardized way we do it on the incidence rate map we publish on our website. And so you can see New York, which had been hit very hard in the very beginning of this pandemic, and then Arizona, which was hit similarly hard, but much later in the pandemic. And now you can see North Dakota is just really blowing away the previous peaks on a population basis for its number of cases, which I think goes to show that this will hit rural America just like it will hit urban America. For Kentucky, if you look at ours, I really, really wish we weren't high like we are now. That's the bad thing. The good thing, if there's a good thing, is this is a marathon, not a sprint. And I think we've conveyed that all along. And as we do that, we are trying to calibrate responses for the actions we take to the impact on society and this disease. And as we have done that, you can see our cases have relatively gradually escalated over the last 7 months to our current all-time high. So as we do that, it gives the hospitals an opportunity to adjust, communities an opportunity to have the resources they need. It gives us here in Frankfurt the opportunity to try to make recommendations for various interventions so that we can keep the disease from surging cataclysmically, if you will. If you look at how North Dakota is spiking up here, those are the kind of sudden surges that you see for New York, Arizona, and North Dakota that overwhelm health systems because the sudden increase in people arriving at the hospital outstrips their ability to care for them all. So far, we've not faced that. I do have concerns that if our escalation were to take off more quickly, we could be in that situation. Let me share that every hospital is going to have to be prepared to expand the number of people it keeps at its own facility for COVID-19. The only people who should be transferred to the larger hospitals are the ones who require the advanced medical care only available at those larger hospitals. This means that every hospital could at some point feel the strain related to caring for more COVID patients. I'm very grateful to the hospital community. I've had the chance to work with them pretty closely over the last 7 months, and am very grateful for their cooperation with me and with each other. I think they have communicated very collaboratively with each other, and I think that's very good for Team Kentucky. Remember, today we are changing to the calculation of laboratory positivity rate using electronic lab reports only. Just to put this in context, last week we had anywhere from 65,000 to 70,000 electronic lab reports coming in per week. That's over 6% of our population in electronic lab reports. It's incredibly robust and quite a testament to where we've come from where we were in the spring and early summer. I'm going to talk now just about some of the interventions. When you look at these graphs here, I'm concerned about some of the perspective people have taken. This is a serious illness and it can cause some serious problems. If I had put up the North Dakota slide for the number of hospitalizations, or actually the number of deaths, you could see that that increases a couple, 2-3 weeks after this spike in cases. This is still very serious. That doesn't mean that it has to prevent us from going on with our lives as best we're able to. The ways we go on with our lives and get back to as many activities as possible are by socially distancing 6 or more feet from each other, wearing masks whenever we're anywhere near other people outside of our household that live with us, washing our hands and having good hygiene that way. Also, staying home if you're sick. Don't go out and expose other people. Those are the things we have to do in order for us to minimize the spread of this disease and buy ourselves additional time until we get a vaccine to take a beneficial effect on producing less illness among us. That was a very sloppy way to say that, but masks work, folks. The misinformation that's out there now about them not working is just misinformation. Every credible public health expert that I'm aware of would tell you that you should be wearing a mask whenever you're out in public. So let's please do that. Now let's talk about the vaccine real quickly. James, if you could go up to the next slide. Wonderful. So this is going to be kind of a quick go through this. This is in general how vaccines are developed. So if you look at the orange and yellow side on the left, this is the basic science part of vaccine development, where they identify the infection, work out its genetic sequence a lot of times, break down its proteins, and they figure out which parts of it to use to try to make a vaccine. Then once they do that and they create the medication, then they go into trials. And so if you look at the green colors in the middle there are 3 phases of clinical research trials before a vaccine is approved. Phase 1 is when they give it to just a very small number of people to make sure it's safe and it doesn't cause obvious harm. Phase 2 is when they give it to a larger number of people to see if it has early signs that it is effective in preventing the disease. Both of these phases, 1 and 2, are relatively small. Phase 3 is when they have found a vaccine that appears to be safe in healthy people, that also appears to be effective in preventing the disease. And then they move to phase 3, which are large-scale trials. In this instance, some of these COVID-19 vaccines will have trial sizes of 30 to 60,000 people, perhaps more, depending how long they run. You have to use large populations like that in order to unmask or find out if they cause harm and if they are effective in a large variety of people who are different ages, different genders, different races, different ethnicities, different medical problems. You want to make sure that the vaccines work well in a wide array of people, find out if it does or doesn't work better or worse in certain folks, and also ensure that you're not causing harm. So this is where we are right now. There are about 6 vaccines that are in phase 2 or 3 trials, I believe, in the United States that are our leading contenders to get a vaccine. So once you have a vaccine that gets past phase 3 and the manufacturer says this vaccine is ready to go, we're going to apply for approval or permission to use it, then you go to the light blue stripe here, which is review by the Food and Drug Administration. The FDA has a rigorous process where it reviews all the basic science evidence that the manufacturer has produced in their research trials. If the FDA determines the vaccine appears to be safe and effective, then it will recommend either an emergency use authorization, it will approve the use under emergency conditions, or it'll do a full approval. In this case, it's almost certain that it'll be an emergency use authorization in order to save time so that we can get the vaccine out to people as quickly as possible to try to blunt this pandemic. Once the FDA approves it, it goes to a committee at the CDC called the Advisory Committee on Immunization Practices, that's ACIP. ACIP will also review the scientific evidence. They will determine if they are in concurrence or in agreement with the FDA's approval, and then recommend in what populations the vaccine can or should be used, and in whom they feel it is a useful tool. So once they make their recommendations, that's when folks like us here in Kentucky and the rest of the states will start getting shipments of these vaccines to administer to folks. And then the last stripe on here is phase 4, which is the big purple band. This is where we continue to do surveillance on the vaccine and the people who receive it to make sure that we don't find, as we vaccinate larger and larger number of people, that it's causing any harms or unintended consequences. James, if we go to the next slide, please. This has been a long process already. There has been discussion about vaccine development throughout this entire pandemic response. The 2 most recent points that I just represent here on this slide are that on September 16th, the federal government released what it called its interim playbook to help give guidance to states for the overall structure for how it intends to roll out the vaccine. And then every state had 1 month to create its first draft plan. And so we submitted our draft plan on October 16th, along with most all the other states, the day it was due. This is our first draft. We'll receive feedback from the federal government. We also have additional details that can't be worked out until we get more information from the federal government, some of which is now just coming out and others of which won't come out until we have an approved vaccine. So this will be one of those things where you get as much ready as you can, and then when new information becomes available, you update it and you move further down the playing field. Next slide, James. When the vaccine first become available, whether it's one or more of them, we'll have relatively small quantities in the beginning. And so what we will have to do is we will have to determine who will get those first small quantities. In a minute, we'll go to a next slide and I'll talk about that process. But what we'll do is initially have to target certain populations to get the vaccine out as quickly as possible. As we go forward in months from there, we'll have progressively larger quantities of vaccine. And then we're cautiously hopeful that by later next year, we should have quite a sufficient quantity to be able to vaccinate the vast majority of the American people. And hopefully by the time we reach the end of next year, everybody who has wanted a vaccine will have had the chance to have a vaccine. So this is showing the slope of this line, how it will increase quickly in the ramp up phase. And then eventually it will hopefully reach what we know for other vaccines, that you just go get one on a routine basis, and it's not a difficult thing to do. Next slide, James. This is my last slide on this topic. So there are a number of different processes, a number of different agencies or groups that have come up with paradigms for helping to guide the ethical and equitable distribution of these vaccines so that we get it most quickly to the people who need it most, and then do that in a gradual and phased approach as quickly as we can based on the supply of the vaccine and the people who need it. So in phase 1A, we're going to, for every paradigm I've seen has recommended that healthcare workers in particularly high-risk settings and first responders get vaccinated first. This is for a variety of reasons. One, they are most likely to get infected in the line of their work. Two, they are also at risk for spreading it to vulnerable people for whom they care. And three, all of society is relying on these people to take care of us should we get sick. And so they need to go first. After that, we'll enter phase 1B, where we'll target some of the highest risk populations. They've done studies that have found that if we vaccinate, for example, the staff who work in nursing homes, we will protect more residents of the nursing homes than if we first vaccinate the residents themselves. The federal government announced last week, though, they are going to partner with Walgreens and CVS, at least those two chain pharmacies, possibly more, in order to distribute the vaccine and administer it to nursing home staff and residents early on in this rollout. There's also adults who are in higher risk age categories, over 65, or who live in senior living communities and other settings that they're higher risk. And then we go on in the phases, and I won't read all of these different ones, but there's a phase 2, a 3, and a 4. And these slides, if you were to Google these things, you could view these documents yourself. This one, for example, is a few hundred pages long. So there's a lot of work that's been done. But once we get actual approved vaccines, that advisory committee on immunization practices will then take that specific vaccine and how it performed. And then if any refinements are needed to recommend any adjustment of a criteria like this, they will be the ones who come out with the final recommendation. Kentucky will then review that. And if we need to make any last minute refinements for our own state, we will do so and we'll move forward. For timing, everybody should expect the soonest a vaccine in small quantities will be available will be December sometime. One of the manufacturers has said that they will possibly submit their materials for review and approval in mid to late November. It will take at least a few weeks for the federal government to have the FDA review it, and then the Advisory Committee on Immunization Practices offer its recommendations, and then the states will have to move forward very quickly from there for distribution and administration. That will not happen before mid to late December. And for the typical American, you're unlikely to have access to the vaccine really until mid to late winter, probably early summer. but hopefully it will ramp up very quickly from there forward, and everybody who will want to have the vaccine can have it. And let's hope that these work and work well so that we can get back closer to the lives that we used to know. In closing, I will say over the weekend, some of you may have seen on Twitter, I shared I was reading some of the letters I've received. I understand I have a whole collection more over at the Capitol, which we'll retrieve tomorrow or Wednesday. I can't write back to everybody, I'm sorry, but I have read them all. And I want to thank you all for sharing your thoughts. You're making a difference, both in what you do back at home and also here in Frankfurt, because reading that, I take into account your feedback, and we do try to be responsive to the concerns you raise. So thank you very much. Thank you for supporting Team Kentucky. And Governor, thank you for this opportunity to share this information with the Commonwealth.
All right. Thank you to Dr. Stack. And I just clarify that all the timing that he just talked about is based on estimates that we have been given from the federal government as to the manufacturing and ramp up of a potential vaccine. If they manufacture it faster, if they ramp it up faster, we will get it out faster. So really the timing of all of it depends on when a vaccine's approved, how quickly it can be manufactured, the federal government's first plan on distribution, how it goes out to states. But my commitment is once it's safe to get it out to those that need it the most as quickly as we can. We're going to do everything to address all these logistical issues and to make sure that everybody who's willing to get vaccinated, if it's safe, will get it just as quick as we can get it to them. That's how we get back to normal. And I'm certainly looking forward to, well, at least a new normal where we take the positive values of compassion that we have shown to one another into a new phase where we don't have to be 6 feet apart. All right, we have a number of questions today. I'm going to try to go through a bunch of them fairly quickly, and then we'll need to bring in Dr. Stack for a couple. Hospitals in several states are reporting that they are near or at capacity. What's the status in Kentucky, and how quickly can the field hospital be available if needed? As of today, we have 65.8% of the state's inpatient beds, hospital beds currently filled. So we still have just about 35% that are open. That is positive, but it can change very quickly as we continue to see numbers increase. ICU beds, 71% are occupied, which means we've got 29% that are open, and we have a lot of capacity on ventilators with just 27.6% currently used. The reason those numbers are what they are is we've been aggressive in Kentucky to make sure we take steps before we run out of ICU beds. Because if our ICU beds are full, it doesn't just mean that we have an issue on number that are available. It would mean that we have 2,000 plus Kentuckians fighting for their lives, and we don't want that. The field hospital is currently disassembled or in the final state of it. It is being stored first out at the fairgrounds, and then depending on how numbers go, back in the warehouse of public health. It can be put back up, I believe, in 1 to 2 weeks at most. There's only one piece we have to order to come back in. Our National Guard did a great job of setting it up the first time, and I know is willing to help us do it again. We believe we can do it on very short notice. And unlike some other situations, we didn't contract this out. We ended up buying the materials and putting it up ourselves so that we can have that there and ready when needed in this pandemic or in any other natural disaster. It's going to provide an opportunity to at least have the bones and the general structure of a field hospital. So I believe that we made decisions to do that in a way that not only has us ready during this, but can help into the future. When was it being dismantled? Well, first it was moved a little bit to allow for some activities that were going on out at the fairgrounds, and then it has been in the process of being packed up again first at the fairgrounds. And then as long as we feel like it may not be needed, back at the Department of Public Health, but it's going to be in a position where we can get it up quickly if needed. How confident are we that actual vaccines will be under vaccinations in early 2021? I am very confident that we will have it started in early 2021. I would not be surprised if it is started in December of this year, but again, it will be small quantities at first, and those frontline healthcare heroes that are exposed to COVID-19 every day, I think we all agree, are the first people who are going to need a safe vaccine, and then working through to get it to those that need it. It's going to be a lot like when we first started this journey together and we didn't have enough tests, and we asked Kentuckians to sacrifice for each other and to wait if somebody else needed it more. We're going to be in that same spot, but we've shown that we're good people that can do that if it means that somebody who needs it more is getting it first. We've seen the mask mandate extended and earlier curfews for bars and restaurants. Are we considering more restrictions back in place, travel advisories, or any more shutdowns? We will be updating the travel advisory. There's going to be some extra information on there. Remember, it is an advisory. It is not a ban. And so, for instance, if you are on the border of a state that is on that advisory, you may use childcare or work in that other state. We're not asking you not to, but we're asking you to be extra careful, because what it means is the virus in that state is at such an elevated state as compared to ours. It should guide you in your actions, how much time you spend there, and how especially careful you ought to be while there. We are not currently looking at more restrictions, but we have got to get these numbers going down. If not, I fully anticipate that the White House will ask us to again reduce bars and restaurants. It's something we don't want to do. So if you support those small businesses, number one, put your mask on. And number two, keep it on when you're in public. 3, make sure that you don't have more than 10 people over to your house or to an event that's not covered by other rules. And we're seeing a lot of spread that way. So be careful. There's a large part of our economy that depends on it. How can we work together to stop the spread more effectively? Well, we got to support one another. We got to support our local public health departments. When we see somebody being berated for trying to do a good job and get people to wear masks, let's not just stand by. Let's make sure that we politely support that individual. Let's make sure we set a better example. Let's make sure we follow each and all of the rules. Let's make sure we get tested regularly. And let's make sure when we get the call and we're asked to quarantine that we do so. See, this is the thing. If you put up the top 10 rules, we now know how to stop the spread of this virus. We've just got to be willing to do it. 10 simple rules that can help us get this under control in Kentucky. Wearing a mask, social distancing, washing your hands and surfaces, limiting crowds and gatherings, and when you see one, don't become a part of it. Stay home when you're sick. Oh my goodness. Please, please do not go to work or out in public if you're sick. Get tested regularly. Answer that call. Follow healthy at work and healthy at school. Make sure you prioritize your mental health and limit your travel. That's it. None of that's rocket science, and we can live through all those restrictions, but we have to do it. No politicizing this whole thing, no playing games, just saving lives, saving our economy, and looking out for each other. This is a question on overpayment from unemployment. There have been some overpayments from our unemployment office, just like in every other state. It's what happens when we have new programs and new eligibility. Our priority right now is to help those that haven't gotten their very first payment or haven't gotten other payments that are eligible. We will get to the overpayment issue. We ask people, obviously, to save that money. We will have to request it back, but we're trying to help your fellow Kentuckian, our brothers and our sisters that right now have not gotten that initial help. When overpayments are determined, OUI notifies the claimant about the overpayment amount and the options. And a claimant who doesn't agree with the overpayment determination has the right to appeal. People who believe they've been overpaid should wait for an overpayment determination before repaying. So save that money. They currently are processing overpayments, and claimants should watch their email for overpayment notices because the appeal period is limited. How long do we intend to keep the 50% capacity restrictions in place on restaurants and bars? Well, can we put up the stair stepper chart again? The easiest answer to this is we certainly can't increase the number of people in a small space while our numbers are exploding. I mean, right now, if we're in a significant escalation in cases, and we are escalating in hospitalizations, and we're escalating in people in the ICUs, and we believe we're seeing more deaths, that's not the time where you increase capacity or you lessen the restrictions. Now, it doesn't mean we have to get to a vaccine before we could increase capacity in restaurants and bars. We just have to do better. We all wear our masks and follow those top 10 rules. That chart will start going down. And we've seen that happen in some other places. So the capacity for different events and all out there, it's all within our power. We only see cases increase when we let our guard down. And if for a sustained period we can keep our guard up and do the right things, we will see cases decrease, and that'll allow us to do more. But we've got to step up and do that. Have we received plans from UK or U of L for men's and women's basketball attendance? If so, what's the status of those plans? I believe we have one of those under review and are communicating. I don't know if that's from the venue or from the university, though. With more Kentucky counties going into the red and NTI going into place in more districts, will you have any discussions, recommendations with KHSAA on the remainder of fall sports season and how to handle winter sports? If we don't get a hold of cases exploding, it is going to make it a real challenge with winter sports. You look at the number of counties that are red, they are increasing, and we can't have an average of 1,000 plus cases a day and increasing and not think it's going to impact our lives. But again, we could do something about it. So let's make sure we wear our masks, we engage in social distancing. Obviously, indoor sports raise a big concern, and high contact indoor sports at a time when cases are increasing. So we have the time. Let's start getting our case numbers down. And that'll make us able to have a much better conversation on how to handle winter sports. I know KHSAA is already looking at that, and all I ask is we're certainly willing to do everything it takes to provide as safe of an environment as we can for our athletes. Let's just always put their health first. I think we all care about the kids first and foremost, and let's make sure that we are showing that. We've looked into needle supply across states. Are we seeing issues in flu shot supply chain because of stockpiling by the federal government in preparation for COVID vaccines? Steve, do we still have you?
Yep, I'm here, sir.
Okay, have we seen that in Kentucky?
No, I've not had any reports of not having those supplies. It is possible that could become an issue, though, because the federal government is a large purchaser, and they have promised that when they ship out the COVID vaccine, they will include needles, syringes, alcohol swabs, and gloves, which is good, but it could create a short-term challenge. So that doesn't surprise me. I have heard that the public is seeking the influenza vaccine in larger numbers this year. So thank you to all of you who are getting vaccinated for influenza. That's very, very important this year. And that some clinics have run out and are waiting for reshipments, but not the needles yet.
Okay, one more. After 7 months, what do studies show now on the protective effectiveness of masks for the wearer?
Every credible public health person that I listen to, and I get to communicate with a lot of them regularly, believes that the masks are clearly protective, that they definitely help reduce the spread of the disease, They protect the people surrounding folks who have infection from becoming infected. And they even in smaller measure probably help the person wearing them from becoming infected. But if we all wear masks, we could really be back to a lot more normal with a lot less worry if we wore them consistently, all of us, all the time we were around each other. So that is very well substantiated and proven, we believe, at this point.
Okay. Thank you, Steve. Next question. Do I have any more details about or comments on the allegations from Treasurer Ball about misspending by the governor's office tied to COVID-19 regulations? Folks, we've seen this type of silly political shenanigans. We are 2 weeks from an election, and what we see before every election is political parties trying to convince you that other political parties don't believe in God or are persecuting members of any specific religion. And it looks like that's what this is going to be, tied to the restrictions we did on all mass gatherings at a time when most states in the country were doing it and where we were seeing significant spread, including 20 individuals that died connected to a revival in Western Kentucky. Every decision we've made has been a hard one. It's been about saving lives. I've talked to you about my faith just about every day that we have talked. It's something that drives me. I'm a deacon in my church, and we could win this battle against COVID-19 by simply loving our neighbor as ourselves. No. We have tried to spend every dollar correctly, and this is again something right before an election that we'll work through. We'll talk to you about what it is, but I've been entirely transparent about the decisions we made, and I even talked to you when we were talking about in-person church service when it was the scariest. I will say, when we think back to that time, there were only a handful, maybe even just one mass gathering that occurred during a time when it was the bleakest. And I really appreciate everybody else that was making a sacrifice to do things right. Is there a chance for a special session to take up policing reform legislation or other matters related to racial justice before the end of the year, or does that seem unlikely? We continue to have those conversations, but what's been made very clear to me by community leaders and our Black Legislative Caucus is to call a special session. It has to be substantial, not window dressing, but a really substantial package of bills that could help everybody. And we, as of yet, don't see that level to call a special session. That doesn't mean that we're not working towards a regular session, but we are committed to true justice and to ensure that every Kentuckian has real opportunity, and that we address those prejudices that exist throughout our society, and make sure that our Kentucky lives Team Kentucky, where everybody counts and everybody matters. As we end tonight, again, look at those top 10 rules. We used to talk about these a lot, but they're just a pretty simple way to remind yourself of what you can do to help us in this battle. Folks, it's going to take all of us, but we can do this. We are Team Kentucky, and we're going to get through this, and we're going to get through this together. Thank you all very much. Thank you to Rachel for your help today.